those who are involved.
For Newzroom Africa on Channel 405, I'm Corinda Jagmohan in Durban.
Higher Health, the national agency of the Department of Higher Education and Training, has launched a 24-hour helpline. It will help address the mental health needs of university and college students and staffers who might be negatively impacted by the COVID-19 pandemic. To talk to us about this is Higher Health CEO Dr. Ramneek Ahluwalia. Thank you so much, Dr. Ahluwalia, for talking to us this evening. Just tell us how this is going to work.
Good evening, Bongiwe. No, thank you very much. We have been working on this pandemic called mental health from a very long time. Mental health, before even COVID-19, has been a major epidemic within the post-school education system. We've got rural campuses in informal settlements, whether it's TVET colleges or CET colleges or universities, and we get students from very historically disadvantaged families, and really we've got challenge with stresses in this young age group coming up into institutions of higher learning, and most importantly, it's always after hours, late in the evenings, when a student himself or a staff finds himself alone, their symptoms of mental health increases, their challenges around them. So the aim was to ensure that they are not alone. They are supported 24 hours. Even if it's 2 o'clock in the morning, somebody is having suicidal ideation, is feeling anxious, is stressed, has symptoms. And the aim is you have somebody, you can pick up the phone, you have a psychologist, 24 hours, you have a social worker, a counselor that can take you through a journey and assist you and support you. Remember, this is our economy of our country. This is our next generation of our bread earners. And we need to ensure that they are looked after. And all what COVID-19 has done to us is COVID-19 has made this reality much higher and much earlier for us to understand that this epidemic is going to affect millions of our students and staff around this country.
And Dr. Ahluwalia, some have asked, particularly after the minister spoke about, this particular initiative and how it is now coming into, the fore for students out there. Some were asking, why now? Why is it that they're seeing such an initiative right now? When there has been pandemics when it comes to, some of our institutions, we have been seeing rapes on campuses. We have been seeing some students being subject to bullying or even, racial tensions there. And some questions then tonight then say, why now? Did it have to take COVID-19 to then set up such an initiative?
No, this initiative of mental health has been with us. I mean, we have been running a second curriculum on mental health now from last 2 to 3 years, having primary health screening. But definitely what we have realized is that that's not sufficient. The primary healthcare element of mental health is not sufficient. We need to put infrastructure more on the secondary health and the tertiary level of health. Secondary level of health is 24-hour service, which is right there for students every time and for staff. And similarly, it goes to the referral system then further. Should a student need further care and counseling, then we have clinical psychologists that are going to be there available in all 11 languages that will be there to follow up. Yes, you're right that COVID-19 pandemic has brought certain things that a lot which was pending to be completed has to be absolutely made sure that now we full flow go into it, considering that the epidemic of all these hidden epidemics have risen quite tremendously due to the amount of stress, uncertain things around their own careers, their own education, life in general. And I think these things do have had a huge influence when it comes to COVID-19 and its indirect influence. And I think though it's timely now, but at least from now, every day, 24 hours, our students and staff will get support and they will not be alone from now on.
Talk to us then about some of the concerns that are raised by students on this hotline.
So they have been, you must remember, suicide remains the second biggest cause of death among young people in South Africa, and so is in higher education, post-school education. So a lot of calls that come are sometimes related to as high and extreme as suicide, and some of them are towards anxiety, about depression, people feeling absolutely anxious, and having symptoms that they just do not know what to do at that moment. So these calls have been very centered around right from anxiety, symptoms of depression, and it goes as extreme as suicide. And I think that moment when a student in the night or in the evening or in a daytime is experiencing this, at least has now a toll-free line, which is absolutely free, has somebody to talk to, and at least there will be a process from there on, a counseling, a guidance, a step-by-step journey of taking the student or a staff coming out of this phase, which I think will save many lives in South Africa.
Thank you so much for talking to us tonight. That is the High Health CEO, Dr. Ramneek Ahluwalia, just talking about a very important subject when you look at the mental health of students and concerns then being raised there about how suicide remains high and some of those concerns around, even